Guys, so welcome again. We're going to talk about chapter 13, which is substance abuse and addiction today. I find this topic to be very relevant to everything that's going on in today's society with opioid abuse, drug prevention, marijuana being a huge topic, alcohol ever growing, things like that. So I do think that this might take a little bit longer, and I ask that you bear with me because some of this might be extremely interesting to you, and you might have some questions for me. And if you do have questions, again, please email me, please call me. Whatever your questions are, I'm happy to address them. So, in talking about substance abuse, I do think it's important to talk about addiction and dependence and how they are very different. So, addiction is a disease. It's a chronic disease characterized by the DSM-5, and it is characterized by compulsive, ongoing use of a drug despite the negative consequences that you are aware that are going on. Now, a dependence is where you feel like you are dependent, your health is dependent upon that drug. It makes you better, you feel better, you feel like your health is reliant on that drug. It's important to also clarify that disease is a lifelong quest. So a disease is something that you can't just get rid of. There's no cure for addiction, and you have to work really hard, and it has to be an active choice for you to choose sobriety versus a drug. And it's also important to note that not all people who are dependent upon a drug are going to be addicts. So you can be dependent on a drug and not be an addict of a drug. Signs of addiction, you pull away from anything and everything, all responsibilities. You crave the drug, you have withdrawals from the drug anytime that you're not on it, and that's your main focus. So you really and truly can't walk away from something and come back and not do it. So maybe you take a day off, but then you come back to it and you're sole focus again, regardless of what people tell you, regardless of what you know, regardless of who it hurts, you're going to do it come hell or high water. Development of an addiction, so genes play a huge part of it. Genetics are 40 to 60% of account of all addiction. So if you see somebody in your family that's an alcoholic or they're addicted to drugs or they smoke cigarettes, that's an addiction. All of those things, please make note of that because that means that you have a genetic component of addiction in your family and you need to pay attention to that. You need to be aware of, hey, I have an addictive personality. I don't need to be out here drinking all the time or smoking cigarettes or picking up something. So be aware of that. Make sure you're looking around at your family history. Exposure, the earlier you're exposed to something, the more likely you're going to try it. Repetition is the key to all learning. So the more times you see it, the more times you hear it, the more likely you're going to be able to learn that behavior. And you're going to probably participate in it. Environment, obviously environment plays a huge role. Home life, family, community, friends. If you hang around people that do it, you're more than likely to try it. If your family does it, then more than likely you're going to try it at some point too. It's also important for me to say that addictions don't occur overnight. One cigarette is not going to mean that you're completely hooked. One drink is not going to mean that you're an alcoholic, those sorts of things, but you do need to be aware of the genetic component and if you do have a predisposition to addiction. Psychoactive drugs, those are going to be a big topic for today because they're the popular ones in society. So legal psychoactive drugs as of right now are caffeine, so coffee, soda, alcohol, and tobacco, and then illegal psychoactive drugs are going to be marijuana. So that's your one illegal psychoactive drug. Men are more likely to use psychoactive drugs than women. Young adults are more at risk for psychoactive drugs because everybody's trying them. Caffeine is super high all across the nation, and the southeast is more prevalent in smoking, and that's because we're the tobacco state, right? So we're going to talk about this a little bit more in depth later on in this series, but do drugs change our brain and how the brain works? Yes. There is no other way for me to say that than just straight up yes. So one, the more that you do that drug, the more tolerance you're going to build up. I don't care who you are. So the more drinks you have, the more you're going to have in the future. So say it takes one glass of wine for you to get drunk. Well, then eventually, the more that you drink that one glass of wine, it's going to take two. And then that two is going to take three. Just like in college, where you experiment with different alcohols, you find out what your limit is. And sometimes that limit increases the more that you get into your college. So freshman year, your tolerance level is going to be a little bit more different than by the time you're a senior. Let's be honest. That's just how it works. And many drugs act on the brain's reward system, which activates dopamine to make you feel that happy vibe. So you feel happy, you feel good, you feel motivated, and you repeat the behavior. Whenever you feel good like that, and dopamine's released in your brain automatically just from doing one thing, then automatically we're gonna do it again. Like, heck yeah, I feel good, let's do it again. And then once we do that, then slowly the brain loses its reward system, and its reward system becomes focused on other things. So when you use a drug so much, it then becomes your reward. You don't see the reward in anything else other than the drug. So the brain does not acknowledge things like monetary rewards or like a food reward or like a relationship reward, even. So things like that, the brain doesn't process them the same whenever you have ingested so much of a drug. It disables your reward system. So let's talk about caffeine, because it's the top psychoactive drug that we need to talk about. So 2 8-ounce cups of coffee per day is safe. It's considered safe. Anything over that is not safe, so you need to watch out for that. So when you drink a lot of coffee, your blood vessels tend to constrict, which causes less blood flow, which tends to reduce, your headaches. Coffee also disturbs your sleep patterns. So obviously it's caffeine, so it's going to interrupt your ability to sleep, and it's going to most of the time, coffee activates your intestines, which makes you have to poop more. Most people who drink coffee have to poop. There are some benefits to drinking coffee. 2 8-ounce cups, again, 16 ounces, no more than that. It reduces your risk of type 2 diabetes, and it improves cognitive function, so it reduces your risk for Alzheimer's disease. And again, caffeine is the same way as any other drug, because it is a drug. You build up a tolerance. So slowly, that 1 cup of coffee that was getting you through the day is no longer acceptable. You need 2. And then slowly 2 is no longer acceptable. You need 3, etc., etc. And then moving forward, we're going to talk about tobacco and alcohol in just a little bit. But I do want to hit on the illegal psychoactive drug, which is a big topic today. Which is marijuana. So marijuana is quickly becoming the most used psychoactive drug in the United States, and it's definitely the most commonly used illegal psychoactive drug in the United States. I think we all know how it works. Most people, by the time they're in high school, have tried it. The statistics are outrageous on people who are trying and doing marijuana. So I don't really feel the need to explain that to you. But what I do feel the need to explain to you is how it affects the brain area, and different things that happen whenever you do it for a prolonged period of time. Now, with all of that being said, we've had this conversation. I've had this conversation for multiple years now with my students, and I'm happy to have this discussion with anybody and everybody. And I'm very open to what people have to say, and I'm very open to a calm and respectful dialect. If you disagree with me, that's perfectly fine. I'm used to being disagreed with on this topic. It's not anything new to me. I have taken a considerable amount of time in the last year to research this topic, because it's so prevalent within college students. It's so prevalent within a community wellness standpoint. So I have done my homework on both sides of pros and cons of how it's best used, medical purposes, anything like that. So if you want to pick my brain about it, please do. Please give me a call, give me an email, whatever it may be. Or maybe you just have more information that you want me to have. I'm more than happy to accept that on any topic. If you think I would find it interesting, please send it my way. I'm always trying to learn. So I say all of that because I want you to understand that I'm not necessarily one-sided, and it may seem like I am one-sided, but I want you to understand the full capacity of this drug. I want you to not just say, like, oh, well, USA Today or US Weekly or Us Weekly said that marijuana now cures cancer. Great. I read that article too. That's fabulous, and I'm all about it. And if that happens, that's more than wonderful. I've had so many cases of cancer in my family; it's not even funny. But there are also different things that come with the pros that we need to be aware of. So again, please keep all of that in mind as we move forward. So, what does it affect? And I've listed a lot of different informational sources on Blackboard that I find to be very interesting. The UK is doing quite a bit of research on it right now with actual human participants. They have different studies going on, so I provided some of those that are very influential moving forward. So take the time to read those if you find them interesting. If not, it won't hurt my feelings. But the brain areas that are affected strongly from this use, at a young age, your memory is affected. So if you start in adolescence when your brain's not fully developed, because fun fact, your brain's not fully developed until you're in your 20s. So if you start in adolescence and you continue to use it, your short-term memory is going to suffer. Thinking, so cognition, thinking dulls. Concentration is limited when you're doing it. So most people that smoke weed or get high are like ADHD patients where they can't focus on more than one thing at a time. So they're focusing on so many different things. Bodily movement, they say that driving under the influence of marijuana is more dangerous than driving under the influence of alcohol. That is under more than one report. So that's under like a CDC report, that's under American Heart Association, I do believe, and it's under a lot of different sites. So please don't think that I'm just making this stuff up. There's definitely research and statistics to back it up. So those are affected. What's also affected that I have found to be very interesting in the brain is that most people want to target marijuana for hurting lungs, which I'm sure that there are pieces of it that do. You're putting something in your lungs that's not good for it. The Lung Association, that's for the whole country, has put a nice little frowny face on it, saying that it hurts your bronchial passages, and part of it has been linked to a bunch of different lower respiratory infections and diseases. It's not been linked to cancer. Obviously, there's different articles out there saying that it helps with cancer now. But what they do say is that most of the time when you're smoking, you're trying to get as much smoke in as you can. So you're really sucking in. Whereas if you're smoking a cigarette, you're not inhaling that much. You're just inhaling and then exhaling. Whereas if you're smoking weed, you're inhaling a lot, which does impact your bronchial passages, and it opens up different airways. They say that people who smoke weed a lot have a lot of mucus. They have a lot of bronchitis issues. Their nose has a lot of issues. So that's the capacity with the lungs. They don't have a lot of research out there saying that anything's linked to cancer, COPD, anything like that. They just say that any type of smoke that you put in your body, whether it be from cigarettes or from weed, is bad. And they're also starting to say that weed has some of the similar carcinogens that tobacco does. So please be aware of that as well. So, but the main thing that it affects is your brain. And that's really and truly one of the scary pieces of all of this, that people want to come back and say that there are pros for people who are suffering with cancer and can't eat. That's a pro. It helps you eat. People who are suffering from pain. That's a pro. But it affects your brain way more than people are willing to let on. And I think that as research continues to develop in that area, I think we're going to find that it's a lot more detrimental than people are letting on right now. So, like we've already said, it affects your memory. It also affects cognitive functioning, which is in your brain. It also affects your reward system. So like I was talking about earlier, with any drug, it's going to affect your reward system. And what people don't understand is that whenever you do smoke weed, you get a euphoric high, which releases dopamine. You feel good. Everything's fine. You're all giggly. You're all bubbly. Well, let's think about that. So we're putting that into our brain. Our reward system is releasing dopamine to make us feel good. Well, what happens when we do that continuously? We use that drug continuously to release dopamine and we feel good. Eventually, the brain is going to stop making dopamine. And eventually, the reward system is going to be inhibited by that drug because we relied on the drug to be happy for so long that our reward system doesn't function to normal anymore. And that's what they're finding in new research in the UK, which I published on Blackboard, is that the reward system is being affected by marijuana use and that people are not as motivated by any other type of reward. And they're not, in a way, they're not being motivated or being happy by anything else other than that drug. So that is a very big piece that is very important. So we have to remember that when talking about the lungs, you can regain lung capacity before 30. So if you smoke all the way up until you're 30, then you can regain almost all of your lung capacity. But your brain does not regenerate quite as well as your lungs. So when talking about different things, they've also discovered different scans. There's limited, the brain does not activate the same after use for a long period of time as someone who doesn't smoke. So I encourage you to do your homework and look at the pros and cons of all of this and look at what it is that is affecting the body. I get the argument all the time that it's a plant. And I love that argument. I do. I understand where people are coming from, but there is so much research out there that's saying that is not the same that it was in the 70s. The drug is not the same. And it's with any other drug, they add stuff to it at this point. So if you think about it, tobacco is a plant. Is it healthy for you? Opium is a plant. Is it healthy for you? So think about it that way, in that capacity. And then the other argument that I get a lot is marijuana addictive? And I get the argument of, well, it's never killed anybody. Perfect. No, it's never killed anybody. It probably won't kill anybody. But marijuana is addictive, and it is about 20% of all cases that are admitted into drug abuse programs. My stats say 15% on the slide, but I'm pretty sure it's more than that now. So it is addictive. Again, it gives you that euphoric high, so you don't ever want to come down. You don't ever want to stop being that happy. You don't want to ever have anything else going on in your mind, because when you're doing it, you're not thinking about anything. That's how it is most of the time. And then withdrawal symptoms, there are withdrawal symptoms: irritability, sleeplessness, decreased appetite, anxiety, drug craving. You do crave the drug. I don't care. All the research out there says that everybody does crave that drug. You have to battle, you have to fight, just like any other addiction. And if you read any of the posts on any of the pro sites, which I love to sift through and read, they will argue with you that there's not any. And like I said, I just encourage you to read some of those because they are informative, and it is very helpful to know stuff like that. Physical changes, I don't think I really need to go over physical changes. They're pretty straightforward. The only one that you need to know about is that right after you do it, your heart rate increases, and most of the time you have a lot of anxiety. Marijuana does increase anxiety and depression. Some people say that they use it to treat anxiety. But it actually causes anxiety and depression, which is why people tend to go back to it more, because they think it's helping, but in reality it's actually this cycle where feel like you have anxiety, but you really don't. It's the smoking that's giving you anxiety because it's playing tricks in your brain because it's a psychoactive drug, and it causes psychosis, paranoia, everything else that goes with that euphoric high where you feel super paranoid. So again, it does increase anxiety and it does produce depression because eventually, again, that reward system, they're related. So eventually in life, you're going to feel super depressed if you're not on it. And then if you are on it, then it's never going to be enough. You're always going to want more. So you're going to build up that tolerance. It's important to note that because your heart rate does increase because of the anxiety and the paranoia when you first do it, then you are at the biggest risk of a heart attack when you do it. You're putting a lot of strain on your heart because you're depleting oxygen. And you're also jacking your heart rate up because you have a lot of anxiety. So again, if you have any more questions, read those articles. I have a lot of other information, pros and cons to it. I know it sounds like it's all negative, but in a world that is really pushing it, then I feel like we should be open and honest about the repercussions of using it in a manner that's not appropriate. So please let me know if you have any questions or you have something to dispute. I'm happy to have that discussion with you. Moving forward, ecstasy. Ecstasy is not super popular anymore, I don't think. Not from my understanding. So I'm going to kind of skim through that. Prescription drugs. So this is a very big topic. So people are popping. You like my term popping? Adderall, Ritalin, Xanax, like they're candy. They now have these pamphlets in the hospital for at-home prevention because kids are getting them from their parents. Deaths due to overdose on opioid drugs. I think it says a third of all poisoning deaths each year, which is probably rising. And definitely it's probably half at this point. So again, prescription drugs are this huge thing, and we're in my new position, we're trying to combat it by doing substance abuse coalitions, we're doing educational pieces, prevention programs, all of that fun stuff. But at the end of the day, they're the most commonly used because people can get their hands on them because they're in medicine cabinets. They're not hard to come by because we can go to grandma's house and pick up a few. We can go to the doctor and say that we broke our ankle or whatever it is. Or say you have ADHD, they're going to give you Adderall. If you have anxiety, then you're going to get Xanax. All of those things we overprescribe and underhelp. That's just my opinion of we've overprescribed. So we live in a society now where we expect immediate relief right then and there. We don't want to really necessarily work for it. So we really I want to feel right then and there. If I'm hurting, it needs to go away. But that's a diatribe. Sorry, that's completely separate from what we're talking about. So prescription drugs, easy to get to. Kids don't understand. Sometimes it looks like candy. Sometimes it looks like ibuprofen. So hey, sure. It looks normal to what we're used to, and it's becoming a very, very big thing. And if you watch documentaries on Netflix or Google Play or Amazon, they have a lot of very interesting videos on the drug epidemic, on what they lace these drugs with. Sometimes they put ketamine, sometimes they put fentanyl. Fentanyl is the new big one where they're mixing fentanyl with something else. And fentanyl is extremely deadly. It's horrible. So if you have any thoughts on maybe how we can combat the opioid misuse epidemic, please give me an email. Maybe you're working in it, maybe you're doing something. I would love some ideas because I truly feel like the solution is better preparing people to not use them, to make the choice to say no, versus trying to reach out to somebody who's already, and we do need to help them. We do, and I would love to help them. But I feel like getting people to say no is a good start. So if you have any thoughts, please let me know about that. Alcohol. So alcohol, 20% of all alcohol consumed is between 12 and 20. Proof, I'm sure everyone knows what proof is. It's the actual alcohol content in hard liquor. Your slide says beef, but it really means beer, so I hope you can translate that. So 12 fluid ounces of regular beer, that's 5%. Most of the time they'll put them on the bottle for you now. If you spend any time in Asheville, which is where I live, they will tell you this beer is 7%, this beer is 3%, with some of the craft beers. 8 to 9 fluid ounces of malt liquor, that's 7%, so liqueur. 5 fluid ounces of wine, that's 12%. Make sure you're careful on the bottle because they'll tell you sometimes they'll be 14.5, sometimes they'll be 7%. So they'll also tell you on the bottle. And then a shot is 40% of alcohol. So make sure that you're aware of all of those, and every single bottle that I've ever seen, especially in North Carolina, the United States, is going to tell you the percentage of alcohol it has or that it contains. I really don't need to tell you who shouldn't be drinking. Binge drinking 5 or more in one sitting for men and 4 or more for women within 2 hours. If you're drinking 5 or more in 2 hours, make sure that you're really paying attention to what you're drinking. That's really bad for your liver. It's really hard on your heart. So make sure that you're not doing that. Please be responsible. Short-term effects of alcohol use, hangover, electrolyte imbalance, your stomach's gonna hurt. It's gonna try and expel whatever it is because it's a foreign substance. It wants it out. So most of the time, your intestines you're gonna have diarrhea or you're gonna throw it back up because your intestines or your body wants it back out. Hangover symptoms, vertigo, think the room's gonna spin, you're not gonna feel good, you're gonna sweat a lot, you're gonna have increased heart rate, you're gonna have a big headache, your muscles might ache, you may throw up, you may not be able to sleep, and you're gonna be sensitive to light and sound, so anything super loud, super bright is gonna hurt your head. Fun facts that most people don't know: coffee nor cold showers are gonna help somebody sober up. Coffee is just caffeine, so you're just gonna make the person who's drunk hyper. So make sure you're paying attention to that. Don't give them coffee. It's really not gonna do a whole lot except for make them hyper and have to pee. Cold showers, you're just gonna piss them off and make them cold. It's not gonna sober them up. It's not like the alcohol content is gonna leave your body because there's cold water on you. It's just gonna wake you up. Sleeping versus passing out. If you're actually sleeping, that is a good way to get off a hangover, but passing out, like blacking out, not knowing where you are, whatever it is, that's a horrible way to do it. So make sure you don't do that and make sure someone's with you. Food, water, and rest are the best combination for reducing a hangover. So long-term health effects of alcohol use, you increase your odds of CVD. Long-term use, 1 to 2 drinks decreases CVD. But again, long-term use, if you're drinking every single day, that's going to increase your risk. It raises risk of breast cancer, liver damage, cirrhosis, things like that. It damages the heart, high blood pressure, congestive heart failure, heart attack, stroke. It also increases your risk for miscarriage and premature birth if you're drinking more. Don't drink while you're pregnant. I shouldn't have to tell you that. Alcoholism, it runs in the family. Chronic disease cannot be treated or cured. Tobacco, so 20% of adults smoke. Smokers are 2 to 4 times more likely to have coronary heart disease or stroke. So smoking not only affects your heart, it affects your lungs. I said that backwards. Smoking not only affects your lungs, it affects your heart. There we go. Cigarettes kill more Americans than alcohol, motor vehicle crashes, HIV, homicide, or illegal drugs combined. I'm not really sure about that anymore with our opioid epidemic, so I'd have to look into that. College graduates smoke at a rate half of people who aren't as educated. There are no differences in rates between ages 18 and 64. And if you do smoke cigarettes, it takes 10 years of your life off. 10 years. Effects of smoking. So, sure. Responsible for 90% of all lung cancer deaths in men, 80% in women, and 90% of all deaths from so CPD, which is chronic obstructive pulmonary disease. Smoking can produce cancer pretty much all over the body. You're putting carcinogens in your body that don't belong. You shouldn't smoke while you're pregnant. I've done some research on e-cigs. E-cigs are not determined to be healthier. They're just water vape. So it's softer on your lungs, but you're still putting carcinogens in your lungs. Hookahs are associated with similar nicotine levels, greater carbon monoxide levels, and you have more smoke exposure because you're typically in a room filled with smoke. And I cannot reiterate this enough about anything that I've talked about thus far. There is no such thing as a safe way to smoke something. There is no such thing. You are putting yourself at risk because you're putting smoke into your body. You're putting something in your body that doesn't belong. When you're putting a foreign substance in your body, then there is no such thing as safe at that point. It's a foreign substance, and your body is going to try and combat it as best it can, but eventually your body is going to use all of its sources that it has. So environmental smoke is a very big thing. Bronchitis, pneumonia, ear infection, asthma, low birth weight. All of those things are big, and they hurt other people's health. There are lots of benefits to quitting. You're going to have more money. Your children will be less likely to smoke. You won't smell a smoke. You'll have a better sense of food. Fingernails and nails will slowly turn white, not yellow. And you'll have more living prospects and more dating prospects. So in talking about all of this, effective ways to quit in general, any type of anything, talk with a doctor. First of all, talk with a doctor. Go to a counselor or go to a center. Doing it on your own is not always the best way to do it. Most of the time, that's a cause for a relapse. So goal setting, talking about things in advance, using certain ways to overcount or counter those things that you're doing. But really and truly, get someone to help you. If I need to go with you, I will go with you. But please, 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 whatever it is, get someone to help you. There are so many other ways out there to cope with things other than substance abuse and drugs, whether it be alcohol, cigarettes, weed, ecstasy, heroin, meth, opioids, whatever it is. There are so many other things that we could be using coping, like going for a walk or exercising or talking to a friend. Whatever it may be, there's so many other more beneficial ways to handle it. And I would encourage you guys to, again, do your homework on whatever it is that you find interesting, or maybe you don't find it interesting at all. But if you do, make sure that you are looking at ways to help, ways to quit, ways to prevent, all those fun things. So if you have any questions, comments, concerns, or you just want to chat with me about any of these things, please email me. Please give me a call. I'm open to any and all discussions about anything that I've talked about today. And I really appreciate you if you sat there and watched this whole video. It means a lot to me. So thank you, and you might get extra credit points if I can see your views. Have a good day, guys.